I am Timidayo Shirumbi, a third year medical student at Plymouth University Peninsula School of Medicine. As part of my student selected unit, I'll be making a couple of ECG videos. I've already uploaded 2 videos in the past. Please go and watch them, and it would help you understand some of the contents in today's video. I have a quiz here just to see your prior knowledge, and I also have this quiz at the end of part 2 of this video with answers. So you could pause the video now, and there's number 8 at the next page. So pause the video and try to attempt the quiz. And these are the learning outcomes of this video. So a quick reminder of the approach to interpreting ECGs. Whenever you get an ECG strip, it's good to have a methodical approach. So the first thing you should do is check the rhythm and the rate. Is the rhythm regular? Is it sinus rhythm? Is it atrial or ventricular? After doing that, check the rate. You could look at my previous video on how to calculate rate depending on if it's a regular or irregular rhythm. Then after finding the rate and rhythm, check the cardiac axis, and we'll talk about that today. Then after doing this, then start following the ECG wave. So go for the P wave, then the PR interval. Remember in my last video I said the PR interval should be 3 to 5 small squares. And then after looking at the PR interval, go to the QRS complex, and then ST segment, T waves, and then U waves and any other thing in the ECG. So to offload the ECG, on a 12-lead ECG you have the limb leads, which are 1, 2, 3, AVR, AVL, and AVF. So you have 6 limb leads. And then you have your 6 chest leads, or chest leads are also known as precordial leads. So you have V1, V2, V3, V4, V5, and V6. So those are the chest leads. And then you have the rhythm strip, which runs for 10 seconds. And you can calculate your rate from this rhythm strip. Watch my previous video on how to do this. So what is a lead? A lead is just a camera angle from which a picture is taken of the heart. So a picture is taken of the heart from an angle. That's a lead. So we have 12 angles. The ECG machine takes a picture from 12 angles. And just to state, lead is different from electrode. You actually connect 10 electrodes when you are putting the stickers, but you end up getting 12 leads. So how is this possible? We'll go over that now. So when you're connecting your ECG electrodes for the limb electrodes, you put your AVR on your right wrist, AVL on the left wrist, AVF on the left ankle, and neutral on the right ankle. The neutral one doesn't count, it's just there as F. Okay, so you get 3 unipolar leads because you only have 1 pole. So this one gives 1 pole, 1 pole, and 1 pole. So AVR, AVL, and AVF are the unipolar leads on the ECG. However, these electrodes combine to form bipolar leads. So you get AVR to AVL gives you lead 1, AVR to AVF gives you lead 2, and AVL to AVF gives you lead 3. This is the Einthoven triangle, but generally I prefer using just drawing out my leads like this. So I draw a Y shape. So draw Y, AVR is on the right, AVL is on the left, and AVF is at the bottom. So that's a Y shape. Then add all my bipolar leads. So lead 1, then the next one is lead 2, and lead 3. If you remember this, you will remember what direction the picture has been taken from. And just to let you know, limb leads, they look at the heart from the side, so they look from the left side, and then from the bottom, from the feet. So that's where they look from. Okay. So views of the heart. So lead 3, AVF and 2, they are pointing downwards, so they are the inferior leads. Lead AVL and 1 are pointing to the lateral aspect of the heart, so the lateral side, left ventricle. So AVL and 1 are lateral leads, because AVR, I'll talk about this later on, AVR is in the opposite direction to the wave of depolarization. Remember, the wave of depolarization travels downwards like that towards the left ventricles. Because AVR is in opposite direction, we tend to call this the forgotten lead, so we tend to ignore this on the ECG. Now, chest leads. As I said earlier on, chest leads are also known as the precordial leads. You attach your V1 electrode, you attach it to the 4th intercostal space. So go to the angle of Lewis, which is directly when you go to the intercostal space directly, an angle of Lewis is the 2nd intercostal space, count 3rd and then 4th. So V1 is in the right sternal border, 4th intercostal space. V2 is in the left sternal border, 4th intercostal space. Then put V4 in the 5th intercostal space, mid clavicular line. Yeah. And then V3 is between V2 and V4. Just put the lead between them. So that's V1 to V4. Now V5 is anterior axillary line, 5th intercostal space, and V6 is mid axillary line, 5th intercostal space. So those are the position, chest position of the electrodes when you attach the ECG stickers. So the horizontal, the chest leads, they look at the heart in a horizontal plane. So it's just like that, horizontal plane, and they also look at it from the side, because V5 and V6 are on the side of the person, so they look at it from that angle. So the way I think about this, if you look at this diagram, you can see that 1, 2, 3, 4 are on the front of the chest. So they look at the anterior chest, anterior portion of the heart. So 1, 2, 3, 4 is anterior leads, and then V5, V6 are on the side. They are lateral, so they look at the lateral part of the heart. Okay, and in some textbooks, you might see them saying V1 and V2 are the anteroseptal leads or septal leads. The way I remember that is septa means division, so 1 and 2 is divided by the sternum, so I remember that those are the septal leads. Yeah, so 1 to 4 are the anterior leads, 5 and 6 are lateral leads. So now let's combine the chest leads and the lateral leads. Chest leads and limb leads. Let's combine them together and arrive at. Yeah. So these are all the leads. You can see that AVR is missing. As I said, AVR is a forgotten lead. So V1, V2, V3 and V4 are the anterior leads. V1 is sometimes called septal leads. V1 and V2 is sometimes called septal leads. And as we said earlier on, lead 2, 3 and AVF are pointing downwards, so they are the inferior leads. And then the lateral leads are 1, AVL, V5 and V6. So 1 and AVL from this diagram, you can see they are pointing to the side, and then V5 and V6 is on the side of the patient, so they are lateral. Yeah. Now, sometimes by looking at an ECG, you can tell which coronary artery is affected. So let's say in another session we'll talk about ST elevation. ST elevation is a sign of could be a sign of acute myocardial infarction. So let's say there's ST elevation in lead V1 to V4. So I would know that that's the anterior part of the heart that's affected, and the coronary artery that supplies the anterior is the left anterior descending. So you can see this diagram. Yeah. So that's the left anterior descending artery. Remember the left main artery. So when you look at the vasculature of the coronary arteries, the coronary artery vasculature, the right main coronary artery and left main coronary artery branch off at the base, at the start of the ascending aorta, and then the left main coronary artery separates into circumflex artery and the left left anterior descending artery. So the circumflex artery supplies the lateral aspect of the heart. You can see from this diagram it's going to the side, and then the left anterior descending artery supply the front. Yeah. And then from this diagram you can see that the right coronary artery supplies the inferior aspect of the heart. So this is just a table. Remember, this is just showing how the ECG changes correlate to the coronary artery anatomy. Cardiac axis. So the cardiac axis refers to the average direction of the wave of depolarization through the ventricles. So this red arrow in this diagram represents the wave of depolarization. The wave of depolarization is more in the direction of the left ventricle because the left ventricle is bigger than the right ventricle, and the reason for this difference in size is because the left ventricle has to pump blood around the whole body, while the right ventricles just pumps blood to the lungs, so it doesn't need to be as big. And the cardiac axis can be anything between, so this red arrow can be from anything from 90 degrees to to minus 30 degrees. So anything in that range is normal. So axis deviation. Let's talk about the normal axis first. When you look at an ECG, how can you tell if there's axis deviation? There are various methods like the graphical method, which is more accurate, but I tend to just use the estimation. So I look at lead 1 and lead 2 and use it to decide, is there normal axis, is there axis deviation, and so on. So in the normal axis, let's say the wave of depolarization is traveling there. You can see that the wave of depolarization is going towards leads 1 and leads 2 because they are pointing in the same direction. So your ECG will show a predominantly positive QRS complex. So whenever the wave of depolarization is traveling towards an electrode, the QRS complex will be predominantly positive. So in normal axis, lead 1 and lead 2 should have a predominantly positive QRS complex. Now, right axis deviation can actually be normal in tall and slim people, but it could also be a sign of right ventricular hypertrophy. So if you have more muscle on the right side, then the direction of the average direction of the wave of depolarization will now be more towards the right. And in this instance, let's say the arrow is there. This arrow is now more towards leads 2, is moving kind of towards leads 2. Both of them are going downwards in similar direction, but it's moving away from lead 1. So lead 2 will be predominantly positive and lead 1 will be predominantly negative. Now left axis deviation, as you can see in this diagram, so it's when the wave of depolarization is anything between there and there. Okay. And it can be normal in short and fat people, but it could also be a sign of left ventricular hypertrophy, so there will be more muscle on the left side, so that will take the average direction of the wave of depolarization more towards the left, even more than normal. But also left axis deviation could also happen in other conditions like conduction problems, but we'll talk about this in a future video. So let's say the wave of depolarization is now traveling there. It's more towards lead 1, so lead 1 will be predominantly positive, while lead 2 is traveling downwards, so the wave of depolarization is traveling away from lead 2, so lead 2 will be predominantly negative. So I'm going to tell a quick story on how you can just look at an ECG and estimate the axis straight away. In case this confused, my explanation has confused you, this story should explain it better. So I call this story a tale of two lovers. So let's say this is a normal person, normal cardiac axis. Lead 1 is pointing up, lead 2 is pointing up. So both of them are pointing in the same direction, both of them are positive. We'll say the relationship is normal. So the relationship between the two lovers is normal. And if you look at the ECG strip, you can see that lead 1 is predominantly positive, so it's pointing upwards mostly. And lead 2 is also predominantly positive, so that's normal cardiac axis. Now let's go into when there's axis deviation. Whenever they are pointing in opposite direction, then there's lead 1 and lead 2 are pointing in opposite direction, then you should know for sure that there's axis deviation. So let's look at lead 1 will be pointing downwards and lead 2 is pointing upwards. Even though they are pointing in opposite direction, the love is no more normal, but they are still seeing each other, so you can see they can just still meet each other there. They are meeting each other, so we say the love is all right, but it's not normal, so there's right axis deviation. And if you look at this graph, even though there's a positive deflection there, the negative is more dominant, so we say that's lead 1 is predominantly negative, so pointing downwards, and lead 2 is predominantly positive, it's pointing upwards. So they are still pointing towards each other even though there's axis deviation, so right axis deviation. Now let's look at left axis deviation. So the two lovers, lead 1 will be pointing up, lead 2 will be pointing down. They are pointing in opposite directions, and if you look at this, you can assume lead 1 and 2 have left each other, so they are going in opposite directions, so they've left, so we say left axis deviation. And if you look at this ECG strip, there's a tiny deflection there, but it's mostly positive, so lead 1 is going up, and there's also a tiny positive there, but it's mostly negative, so lead 2 is going down. And you can see that they are pointing in opposite directions, so we say they've left each other.